Hey guys, happy Friday.
Hi.
So all our doctors are away at a seminar today, so we've got all our lovely CAs to help me do our Friday live. So thank you guys. Today we're going to be talking about the 5 tips for sleep problems in children. So when we look at sleep problems in children, it can be a really big issue, not just for the child or the baby, but for actually the family as well. It creates a whole heap of issues that can sort of prolong and build up and up and up and cause all these things as we go through life. And some of the things that are related to sleep issues are cognition, the way that we think, and moods and behaviours can be massively affected too. And even our overall health, which can affect things like our immune system. So when we look at sleep issues, there's 2 main things that we want to have a look at. There's a behavioural pattern behind a sleep issue, and the second one's a medical issue. So if there's a medical issue, like for example an ear infection, that needs to be screened and ruled out by a doctor, for example. What we do here at Sprouting Health, we look at musculoskeletal issues that can be related to comfort for the child. For example, how comfortable they are when they go to sleep, which can cause irritable behaviour, can also be related to feeding issues as well. So they're the 2 main issues. When we look at the medical, we need to screen and rule that out, but we're going to actually give you the tips about the behavioural origins of sleep issues today and some things you can really more easily do at home. They're the easiest things to change and implement. So we've got 5 tips for you guys.
Yeah, so the first tip is to rule out that there isn't anything medically wrong with your child or with the child. And the second one is also just to ensure that their room is nice and dark and nice and quiet for them.
Perfect. So the next 2 tips are setting a regular bedtime every night for your child, but also a standard wake up time every day for them.
And the last one is no caffeine close to the bedtime, and we recommend no later than 3 p.m.
Yeah, thanks guys. And that caffeine tip, so even for breastfeeding mums too, because we know that can go through breast milk, so I want to be really careful. And that could be like Coke as well as tea or coffee. Just be aware of that one.
And we have a little bonus tip too. So it is just limiting screen time. So about 1 hour before bed, limiting that screen exposure. So that's the blue light, because blue light, the research has shown, may reduce melatonin in your children.
Yeah, absolutely. Thank you guys. So hopefully those 5 tips, and we always like to over deliver here at Sprouting Health. We gave you a 6th tip as well. Thank you, Leah. So implement those tips at home, because really the first tip was to get the medical things screened out. So really got 5 takeaways that you can actually try at home and get them implemented and hopefully break through some of those sleep pattern issues if anyone has any of those issues. If you'd like more information on behavioural management techniques, we have some amazing referrals we can direct you towards. Make sure you ask us for that. If you'd like more information about how we can deal with some of those musculoskeletal issues that can relate to sleep issues, make sure you come in and see one of our amazing doctors. Have an awesome weekend, guys.
Yeah.
See you later.
See you later.